Welcome to our channel. Today, we're diving into an inspiring and thought-provoking topic: the contributions of African and Caribbean nurses to the NHS, National Health Service, in the UK. Let's get started. We are going to answer some of the most asked questions. What is the total number of Nigerian nurses in the United Kingdom? What is the total number of Ghanaian nurses in the United Kingdom? What is the total number of Zimbabwean nurses in the United Kingdom? What is the total number of Caribbean nurses in the United Kingdom? How many African nurses are there in the UK, and which countries are the greatest contributors? As of June 2023, African nurses and NHS staff make up a significant portion of the healthcare workforce in the United Kingdom, demonstrating their critical contribution to the NHS. Among the African countries represented, Nigeria, Ghana and Zimbabwe stand out as the top 3 contributors. This article explores their impact and addresses key questions about their presence in the UK healthcare system. Total number of African nurses in the UK. According to NHS workforce data, there are 48,677 sub-Saharan African nurses and NHS staff working in the UK. This number reflects the growing reliance on African professionals within the NHS, with their representation increasing from 1.8% in 2016 to 3.8% in 2023. Number 1. Nigeria, the leading contributor. Nigeria ranks as the top African country contributing to the NHS workforce, with 22,851 nurses as of June 2023. Nigerian nurses have long been a critical part of the UK healthcare system, with their numbers surging over the past decade. Significance: Nigerian nurses bring a wealth of experience, often filling roles in understaffed areas of the NHS. Impact on Nigeria. However, this migration has created challenges for Nigeria's healthcare sector, which faces staffing shortages. Reports indicate that over 75% of Nigerian doctors and nurses trained abroad have migrated to higher-paying roles in countries like the UK. Number 2. Ghana, second in the rankings. Ghana follows Nigeria with 6,134 nurses contributing to the NHS. Remarkably, the number of Ghanaian nurses in the UK has outpaced those practicing in Ghana itself. Reasons for migration: better pay, improved working conditions, and career advancement opportunities attract Ghanaian healthcare professionals to the UK. Domestic challenges: this migration has led to concerns about healthcare access in Ghana, with experts warning of a potential crisis in patient care. Number 3. Zimbabwe, closely behind Ghana. Zimbabwe ranks third among African contributors, with 5,917 nurses working in the NHS. Key factors: Zimbabwean nurses have sought opportunities abroad due to economic instability and low wages in their home country. Significant growth: the number of Zimbabwean nurses in the UK has risen sharply in recent years, highlighting their increasing role in the NHS workforce. Contributions beyond the top 3. While Nigeria, Ghana, and Zimbabwe dominate the numbers, other African countries also play vital roles in supporting the NHS. Countries like Egypt, 4,148 nurses, South Africa, 2,226, and Kenya, 1,936, are significant contributors. The bottom 25 in the rankings. The diversity of the African workforce extends to smaller contributors, with countries like Tunisia, 85 nurses, Namibia, 99, and Morocco, 120, at the bottom of the list. These nations, while representing fewer numbers, highlight the global reach of African healthcare professionals. These numbers emphasize the depth and breadth of African contributions to the NHS, illustrating the vital role of African nurses in the UK's healthcare system. Number of Caribbean nurses in the UK. Jamaica leads the way. Among Caribbean countries, Jamaica stands out as the top contributor to the NHS workforce. As of June 2023, 2,709 Jamaican nurses are employed in the UK, making them the largest Caribbean nationality group within the NHS. Migration drivers: Jamaican nurses are drawn to the UK by better salaries and professional opportunities. However, this has led to workforce challenges in Jamaica's own healthcare system. Broader context: other Caribbean nations like Trinidad and Guyana also contribute, but Jamaica remains unmatched in its numbers. These statistics highlight the indispensable contributions of Caribbean and African nurses, who form a vital backbone of the NHS workforce while also posing questions about the impact of brain drain on their home countries. Next, we analyze misleading claims from Southern African news. Analyzing discrepancies. Misinformation about Zimbabwean healthcare workers in the UK in Southern African news outlets. Recent articles from Southern African news outlets, such as News 24 and New Zimbabwe, claim Zimbabwe has seen an exodus of healthcare workers to the UK, with figures like 36,000 or 20,000 being cited. However, these statistics starkly contrast with verified data from NHS UK government records and official visa statistics. Arousing even more suspicion and lack of credibility, South African news sources claim to have obtained the data from UK government sources, but there is no such data in the UK database. This article evaluates the inconsistencies in these claims, highlights the verifiable statistics, and examines why such narratives persist despite the lack of credible references. Verified NHS data versus media claims. NHS statistics, June 2023. According to the NHS data, 5,917 Zimbabwean nurses were employed in the UK healthcare system as of June 2023. This number represents the total Zimbabwean nursing workforce within the NHS. Media claims. News 24 claims that 20,000 Zimbabweans were granted health and care worker visas in a year, accounting for 17% of total visa holders. New Zimbabwe suggests that 36,000 Zimbabweans were granted work visas between June 2023 and June 2024, with the majority working in healthcare. Discrepancies and questions. Inflated figures. 20,000 versus 5,917 nurses. News 24's claim that 20,000 Zimbabweans were granted health and care worker visas implies that a significant portion would work within the NHS. However, the NHS's official figure of 5,917 contradicts this. If the remaining 14,083 individuals are employed in private care or other sectors, this context is missing from the report. 36,000 versus NHS data. The claim by New Zimbabwe that 36,000 work visas were granted is likely misleading, as it conflates total visa types, health, care, dependents, and others. Dependents and workers in non-healthcare sectors are included in this figure, but these distinctions are not clarified. Lack of verifiable references. None of the cited articles provide links or references to official UK government databases, such as the Home Office visa statistics or NHS workforce reports. This omission raises doubts about the authenticity of their figures. Potential reasons for misinformation. Sensationalism for engagement. News outlets often use exaggerated figures to attract readership, particularly on contentious issues like migration and brain drain. High numbers evoke stronger emotional reactions, making the articles more shareable and engaging. Misinterpretation of visa data. Visa statistics often include dependents, temporary workers, and those in non-healthcare roles. Misinterpreting these as healthcare workers inflates the numbers. Political narratives. Migration statistics are used to highlight domestic issues like economic collapse or healthcare mismanagement in Zimbabwe, often aligning with political narratives. Lack of accountability. The absence of robust fact-checking mechanisms in some news outlets allows for unchecked claims. Insights from NHS data. Zimbabwean representation in context. Zimbabwe ranks third among African countries contributing nurses to the UK, after Nigeria, 22,851, and Ghana, 6,134. Despite its economic challenges, the actual number of Zimbabwean healthcare workers in the NHS is far smaller than media reports suggest. Private sector employment. It is plausible that many Zimbabwean healthcare workers are employed in the private sector, such as care homes and private clinics. However, even combining these sectors, the numbers are unlikely to reach the inflated figures cited. Impact of misrepresentation. Policy misguidance. Inflated figures can misinform policymakers in both Zimbabwe and the UK, leading to ineffective or disproportionate measures. Perpetuation of stereotypes. Such claims reinforce narratives of an uncontrollable brain drain, ignoring the structural issues driving migration. Erosion of trust. The lack of credible references undermines trust in media outlets, making readers skeptical of legitimate issues. Conclusion and call for accuracy. The verified NHS statistic of 5,917 Zimbabwean nurses starkly contrasts with media claims of 20,000 or 36,000 healthcare workers. Southern African news outlets like News 24 and New Zimbabwe fail to provide credible sources, resulting in misleading narratives about Zimbabwean migration to the UK. For accurate reporting, media must cite verifiable data. Official UK Home Office and NHS statistics should be the benchmark. Readers should critically evaluate reports. Sensational claims should be cross-checked with authoritative sources. Governments must clarify statistics. Transparent reporting on visa types and employment roles can prevent misrepresentation. Inaccuracies harm public understanding and policy making. Addressing these gaps is essential for fostering informed dialogue on migration and healthcare challenges.